respect.
Solidarity People Before Profit. Deputy Smith, sharing 5 and 5.
Is more an náire an rialtas seo go heporthú an cuaram lani a láthar dar nibirthú sláinte I lár an pandéim seo. It's absolutely breathtaking, the failure of the state and the government to provide basic childcare for our frontline workers, particularly our nurses and doctors in the middle of this pandemic. After 8 weeks of spin and PR management, 2 months where the problem was recognised, and we have an abject failure to deliver any kind of childcare for the frontliners. That's because I believe we have a hopelessly fragmented and complex system of preschool childcare and a hopelessly and inadequate and equally fragmented system of after-school childcare. We've multiple schemes with the burden of the costs shouldered mostly by the parents in a sector with many large and small private providers employing dedicated but low-paid and often on precarious contracts staff. There's any attempt to have oversight and an attempt to ensure universality in terms of the working conditions and the standards across the sector. A fragmented system of childcare in which the state has absolved itself of responsibility and has overseen a largely privatised system grow in response to the needs of working people. Like a lot of things, the failure stems from the wider failure of this state to provide for universal care. We see it in the nursing homes, in our hospital system. We see it in the direct provision, where we contract out and subcontract out the care and the needs of key public services. And I think we can thank consecutive Fine Gael and Fianna Fáil-led governments for this move towards neoliberal privatisation. And I want to suggest that this failure is not about public liability insurance, although that may be an element of it, and not just about the lack of uptake from childcare workers, although how it wasn't possible for the state to provide rewarding terms for those workers is beyond me. But it's a wider systemic failure, and this pandemic is actually revealing very much about how normal, privatised neoliberal models that let us down in normal times become massive roadblocks in the middle of a crisis like this pandemic. So we end up firefighting the symptoms, and so far we're failing in the area of childcare. So my question to you really, and the only question I really want you to try and address, is that there are demands from the nurses' unions and others that the defunct scheme that you talk about of 4.2 million a week be used and transferred to frontline workers to compensate them for the money that they've paid out for childcare and will continue to have to pay out for childcare because the state is failing to provide it. I support that demand, and I want to ask you, Minister, will you support it? If the 4.2 million was there to allow for the care of children of the frontline workers, why can it not be transferred into those pockets of those workers, those nurses and doctors, who we know from their evidence are paying out hundreds, often per day or per week, to keep their kids minded while they go to work for all our sakes?
Thank you, Deputy Minister.
So you want me to answer just that question?
Just that one question.
Okay, rather than comment on your commentary, that's fine. Is Deputy Murphy coming in?
You have a minute and a half.
Oh, okay. All right. The explicit question is, would I support using that money in order to give effectively cash to the, is that right, to the frontline, or sorry, to the, sorry?
Compensate.
To compensate, exactly. It's, I suppose there are one or two, what I will say is that there are one or two options that I might have suggested subsequent to the in-house model not being taken up for all the reasons that I've already outlined, that would attempt to make some kind of support to the healthcare workers, and those weren't accepted. So we are moving towards the reopening and phase reopening on June 29th. I mean, that's as honest as I can be with you, Deputy.
Not accept them, or why they weren't accepted?
Well, you know, although we develop the schemes, we do that in the context of, I suppose, ongoing work consultation, actually with a group of cross-government department, whether Taoiseach, Deeper, the Department of Health, the HSE, working on anything related to COVID, and I think you're aware of that. So it's anything that's been developed in relation to childcare, as well as other aspects that are there in the COVID context, are going in conversation and deliberation with that group first, and then it comes to cabinet.